As Democrats work to reach an agreement on their social spending agenda, some programs proposed to help families may need to be scaled back. The president and Democratic lawmakers had been pushing for a $3.5 trillion reconciliation package. However, Democrats need every single member of their caucus to pass it, and some centrists have balked at the price tag, forcing lawmakers to cut it down to about $2 trillion. But President Biden says that he is confident that they will reach an agreement.
Are you close to a deal?
I think so. You know, look, I was a senator for 370 years, and I was relatively good at putting together deals.
For more on this, I want to bring in Sarah Ewall-Wice. She is a CBS News reporter covering economic policy. Hey there, Sarah. One of the programs that looks like it will, in fact, be cut back is paid leave. What's the latest with this?
So what we know about paid leave is this is actually a popular idea across the board for Americans. CBS News polling found about 73% of Americans support a federal paid leave program. What the White House and some Democrats had been proposing was a 12-week paid leave program. This is paid family and medical leave. We found out that the president confirmed last night that this would be scaled back to about 4 weeks. We had been hearing that from some aides as well earlier in the week. So this is something that would be cut back. What it is a program that would allow workers to take time off should they be facing a health issue, if they have to take care of their own health, or if they have to take care of a loved one. For the family leave side, it's to take care of a new baby for both parents as well as for those adopting or those fostering. And there were some days put in there as it stands also for bereavement and a few other provisions. What this currently looks like, and it's going to be interesting to see as they parse this out and get into some of the details. But what we did see in the proposal that was originally rolled out is that workers would receive about 2/3 of their pay when they take this time off. There would be higher pay for lower income workers. And some states already have paid leave. Those states would be able to keep their programs. Some employers already have paid leave. They would be able to keep their programs and opt out of the federal program. But this really would just close the gaps in coverage for people across the country. So while we've seen it scaled back dramatically in the current proposal, it does look like something that we will see movement on. And the United States happens to be the only country, wealthy country, that does not currently have paid leave. So advocates for this, even though it's scaled back, have called it a win. And they're still pushing to make sure that this becomes something permanent in the United States.
But that is quite a concession on the federal level, from 12 weeks to just a third of that, 4 weeks. And Sarah, I know you've been speaking with lawmakers and Americans who have been pushing for paid leave. What have you learned?
Yes, so lawmakers that I've spoken to have been pushing for this for some time. Senator Patty Murray, for one, has actually been pushing for paid leave since she entered Congress in 1993. Others have been pushing it for a long time as well. And what lawmakers have told me is that this is something, obviously, that's been an issue for a long time. With that said, however, the coronavirus pandemic really pushed it front and center when we saw people having to make decisions about taking care of sick loved ones, about working themselves when they were sick. So this is something that has gained momentum in the past 18 months. But it has been something that has been around for a really long time, the push for it, that is. And I've spoken to workers across the country, and some of the stories I've heard really show what this means for Americans. One woman I spoke to, she has 5 children, and she was actually having twins. She ended up having to have an emergency C-section for her twins, and she found herself at home after giving birth and having that emergency C-section actually by herself. Her husband did not have parental leave, so she was at home with 2 newborns after having surgery, and 2 newborns out of 5 children in total. Another worker I have spoken to told me how she'd been taking care of her father for more than a decade. She's never had paid leave to help take care of him, and he's just getting older, and she's been taking care of him as he's been in and out of the hospital after he fell off a roof during work more than a decade ago. So she's scared of what happens as she continues to have to take care of him moving forward without any type of leave to do so. And then another woman I spoke to, she talked to me about how she ended up having to go back to teaching after she had a C-section herself. She couldn't take time off because she didn't have enough money. She wasn't having an income coming in. So she went back to the classroom and she told me how she was laying on the floor when her children were not in the room in pain and she couldn't get up. Another worker talked about being unable to be with her father during surgery. So this really hits millions of people in different ways. I wanted to talk about something you mentioned. It is a huge concession moving it down to 4 weeks. And that is true. And this also would put it still behind many other wealthy countries around the world that would have a program that already have programs that are much longer than 4 weeks for paid and medical leave.
So, Sarah, we've obviously been focusing on the paid family leave provision of this social spending plan. Just really quickly, what else might be on the chopping block? What else are the sticking points?
So there are issues right now with extending the child tax credit. The original plan was to extend it through 2025. Now it looks like it'll be extended 1 to 2 years. And this is something that Democratic lawmakers have been pushing for some time, and it really does pose a challenge for them because this would be running out right through the midterm election should it only be extended for 1 year. But lawmakers I've spoken to have cautioned that they're still pushing for this. Another thing that'll be interesting to see is how this is all paid for. We do know right now that they are considering a billionaire tax because one senator is opposed to raising taxes on corporations and the wealthy in other ways. So that is something that they are looking at. It'll be interesting to see what they come down on. We do know there are some sticking points still in terms of health care. Speaker Pelosi did tell us today that they have reached agreements on climate change. So we are getting closer to kind of seeing what a finalized deal might look like, and that could happen as soon as next week. But everyone, of course, is still waiting to see some of the details and the finalized plan.
All right, Sarah, thank you.